Hi, today we have Dr. Gopal S. Pillai with us. He is a professor and a head of ophthalmology, Amrita Hospital, Kochi. Today I'm going to ask him about the eye care and the new technology in AI. Let's have some questions and discussion with the sir. Hi sir, how are you?
Hi.
Sir, I have a few questions related to eye care.
Sure.
And these days, some of the diseases are coming which is new to everyone. And really want to discuss about what is a diabetic eye disease, sir? Which is a very frequent question, sir.
Diabetes is basically increase in the blood sugar levels. As we all know, diabetes is a very common disease in India. Indians get diabetes. Indians or our ethnicity gets diabetes about 10 years before maybe other ethnicities, etc. Diabetes affects each and every cell in the human body right from head to toe. And eye is no exception. So we have diabetes affecting even the lids with more infections. We have more earlier onset of cataract, which is opacification of the lens. We have higher incidence of glaucoma, which is increase of pressure inside the eye in diabetic people. And finally, we have diabetic retinopathy, which actually is a killer. It blinds a person very rapidly. So all these problems occur in diabetes in a person over 20 years.
Oh. Okay, so they have a complication on the overall body also?
Oh yes, diabetes affects, as I said, all cells in the human body. The way it affects is like it reduces the blood supply. Diabetes and cholesterol and the sugar and the advanced glycation products, they will deposit in the blood vessels. And the blood vascularity to each and every part of the body will reduce. And the body will have compensatory mechanisms to counter it, and some of these complications will develop because of those. We have diabetic heart disease, which is like heart attacks will occur, it will be a silent heart attack, strokes can occur faster. Then you have diabetic nephropathy or diabetic kidney disease, which actually affects the kidneys. You have almost skin disease, anything that you look at, every single part of the body is affected by diabetes.
Okay. So in your answers, you have mentioned something diabetic retinopathy. I just want to know what is that, sir, exactly? What is diabetic retinopathy?
I told you right now that the blood vessels get affected by deposition of advanced glycation products. So that will reduce the blood supply to the retina. Retina is that part of the eye which is on the back of the eye, which is like a screen in a camera, a film in a camera. The camera has a lens in the front and it is a film in the back. So retina is akin to that, and the rays of light gets focused through the cornea and the lens right into the retina. And this retina, the vasculature gets significantly blocked. So what happens is that the oxygen levels to the retina reduces. Once the oxygen level to the retina reduces, the cells cannot survive without oxygen. Some of the cells die off, the other cells start crying for help. This crying is basically mediated by certain chemicals called vascular endothelial growth factor, VEGF. And this VEGF actually increases the leakage from the blood vessels, or it will cause new blood vessels to form. All these are harmful. So what happens is this leakage of oxygen through the blood vessels also causes leakage of fluid. And this fluid at the center of the retina will cause edema and decrease of vision. Now I told you about new blood vessel formation. This new blood vessel formation can actually, these new blood vessels do not have as much strength as an original blood vessel, and they are very fragile. They will just bleed while you cough, sneeze, or have a vibratory motion of the head or something like that. So then what happens is there is a bleeding, loss of vision. So a diabetic retinopathy is a condition where long-term diabetes can damage the eye and can cause complete loss of vision.
Okay. So how we can prevent this?
Oh, prevention is always better than cure. So when you have a diabetic patient, usually up to 10 years of diabetes, you do not have diabetic retinopathy. And then between 10 and 15 years of age, of diabetic age, what happens is this diabetic retinopathy moves through mild, moderate, severe, very severe diabetic retinopathies, and then reach what is called proliferative diabetic retinopathy. That is a stage where you can suddenly lose vision. So how can we prevent it? One, controlling your diabetes quite well. There has been studies like DCCT and UKPDS which showed that if you control your diabetes really well initially in the first 20 years of the diabetes, in the next 20 years, not only eye, all the complications across the body can be significantly reduced. So control of diabetes is a very, very important thing, especially in the first 15 to 20 years of your diabetic age. Then, as you are having diabetic retinopathy, I told you that this is a very slow progression. So because it is a slow progression, at any point of time your eye doctor could look into your eyes and see what stage you've reached. And based on that, you could have an early treatment. Once you treat early, chances of retaining your vision for a long period of time significantly increases. So it's important that every diabetic patient, go and see a retina specialist or an ophthalmologist at least once in a year and make sure that the retina doesn't have a lot of problems. And if it has problems, your doctor will obviously tell you what to do to prevent the visual loss.
Okay. So one more question actually out of curiosity. Is there any specific age in this thing? As in kids can also have this thing, or specifically diabetic patients can, or normal as in me, at Touchwood, I don't have a diabetes right now, but is there any case that I should also have this, or my kids, anyone?
See, when we speak about diabetic retinopathy, it is specific to diabetes. At your age or a kid's age, there are lots of other diseases which can happen. So if your question is, should a kid or should a person of 40 years of age see a doctor, then the answer is yes. No, for kids, there are lots of diseases including short sight, myopia, and many of the other diseases including squint, amblyopia, lazy eye. All these problems occur in kids which are treatable. So before school going age, maybe by 4 years of age, it's better to see a doctor. Our government has actually envisioned a school screening program for kids at about 5 years of age. But it may not always be foolproof. So it's always better that you get your kid examined for a problem. Likewise, at 40 years of age, usually you start getting presbyopia, which means you will start reading glasses. So that's one opportune moment where you can show a doctor, see your intraocular pressure to look at glaucoma, see your retina for any other problems, etc. And maybe once in 5 years would be okay initially. And when you are more than 60, probably once a year would be a good frequency to have an eye checkup.
Okay. So actually, recently I heard that there is some injection we used to put in the eyes. Can you just explain?
Okay, I told you that there is something called VEGF, or vascular endothelial growth factor, which comes out as a cry mechanism for the ischemic cells, when the vascularity is reduced. So the ischemia causes VEGF release, and the VEGF causes edema of the retina, which causes decrease of vision, or it causes new blood vessels which can bleed. Both of these can be reduced if you inject inside the eye. So if I have a patient who has a lot of edema in the macula is the central part of the retina. If there's a lot of edema in the center, if I inject him with this anti-VEGF injections, his edema can reduce and his vision can improve. If you have a bleed or a lot of new blood vessels which are about to bleed, if I give an injection, actually the bleeding tendency significantly reduces. So selectively in some patients, wherever indicated, an injection can be a real panacea.
Okay. So how diabetic retinopathy, blindness, how we can prevent that? How we can prevent this diabetic as an early
if
stage?
left untreated, diabetes can completely cause irreversible blindness. And the problem to that blindness is you have a window of opportunity where you can treat it. And after that particular period of time, your vision is gone permanently. That is the problem. So that window of opportunity, that time, the temporal time when which we have to treat, we need to pick up that particular patient. So before he develops diabetic retinopathy, if a patient is diabetic, at least yearly, that person needs to be seen by an ophthalmologist. His eyes are dilated and a retina examined to pick up any retinopathy. If there is no retinopathy, he can control his diabetes, come back next year. Once he starts having retinopathy, we will grade the levels of retinopathy using tests like fluorescein angiography and OCT, etc. We will grade the diabetic retinopathy, and based on the grades, we can treat the patient. Treatment can be, laser treatment, intravitreal injection treatment, or in some advanced cases, it may be surgical treatment. So all these are designed in such a way that you are at least trying to retain the vision of the patient, and in patients whose vision is completely gone, it is about bringing back some element of vision. So as I told you, it is very important to treat the patient during this particular time, after which it is permanently blind, before which he need not get treated. So it is important to find out this time in a patient, and that is why we will want yearly follow-up of that particular patient.
Thank you, sir. Thank you. It's actually amazing, sir. Thank you for sharing this valuable thoughts with you. Any advice to our audience, just for a...
Yeah, I would just want to say about one experiment which was conducted maybe in the 1980s. It's an old experiment. They had diabetic patients who were about 2,000, 2,500 of them were divided into two groups. One group was tightly controlled and one group was loosely controlled. One group of people were, daily they measured the blood sugar and they gave insulin daily. Do you think it was the tightly controlled group? No, it was a loosely controlled group. The tightly controlled group were admitted, and 5 times a day they checked the blood sugars, and 5 times a day they regulated the insulins that the patient had to do. This is called the DCCT study. And now this continued on for about 1 to 2 years. And so the tightly controlled group was like crazily getting controlled, whereas the other guys, like once in a day blood sugars were checked and controlled. After 30 years, even now, the tightly controlled group of that particular time are having lesser complications of diabetes as compared to the loosely controlled of that time, which means daily blood sugars. Our patients take blood sugars once in 2 months, once in 3 months, and you see how loose is it. So my advice would be, control your diabetes really well in the first 15 to 20 years, and you can live happily for the next 20 years. So that's a very important thing. The second important thing would be, at least once a year, a diabetic patient should show an ophthalmologist for any problems that may be, and then whatever the ophthalmologist tells you, probably you can take your retinal pictures or scans, and based on that we can plan treatment to retain your visual acuity. If treated properly, 90% of patients will retain good vision till their last time.
Thank you, sir. Thank you so much.
Thank you very much.
Thank you.
Thank you.